Okay, well, we've talked a lot about blood in this class, so now we're going to talk about urine and the urinalysis. So in this lecture, we're going to discuss the steps in a routine urinalysis, the equipment you will use to perform a urinalysis, the three parts of a urinalysis, which are the physical, the chemical, and the microscopic. And we're going to learn the chemical properties of urine that are tested on the reagent strip, which is part of the chemical, and also understand how to use the microscope properly for a urinalysis. We're going to talk about some of the things that you will see in the sediment in the microscopic evaluation. These include things like cells, bacteria, crystals, and urine casts. And then lastly, we're going to talk about urinalysis, which is another word for the formation of stones. So what is urine exactly? It is a liquid or semi-solid waste product that the body excretes through the urethra. The kidneys produce urine by filtering waste and excess water from the blood, which is then stored in the bladder until it's released through urination. The filtering of the blood is done in the nephron, which is the filtering unit of the kidney, and the blood is brought to the kidney through the renal arteries, and it reaches the nephron, and the nephron filters out the waste and brings the waste into the ureters, into the urine, releases it into the ureters, and then in the tubules, some of that is reabsorbed. So all the chemical reactions in the body create byproducts, and some are useful and they can be reabsorbed, and some are considered waste and need to be eliminated by the kidney, and all of that is done in the nephron. So the urinary tract system consists of two kidneys, the left and the right, the ureters that bring the urine that is released with the waste into the bladder, and then the urethra, which takes the urine out of the body. The lining of the bladder is filled with transitional epithelial cells, which allows it to stretch so it can hold the urine. It can get bigger and smaller as it fills or empties. And urine is constantly produced unless there is an issue with kidney function, which is usually related to a problem in the nephron. Okay, so to run a urinalysis, the first thing we have to do is obtain a sample. That is collection, and we'll talk more about that in a second. And then also store and handle that sample in the correct manner. So when we run the urinalysis, there are three components, again, of a urinalysis, and those are the physical, where we observe and smell and look at the urine, the chemical, where we run certain chemical tests on the urine, and the microscopic, where we evaluate a slide of the urine under the microscope. All right, so let's talk about some of the ways we can collect a urine sample. Firstly is the voided of free catch, which simply means that we are catching the urine as the animal urinates. This is best with dogs. You can kind of follow them around with either a sterile cup or a soup ladle works pretty good. However, this technique is not considered sterile because the urine can be contaminated by the bacteria on the outside of the skin. And then if we're using non-absorbent litter to catch urine, it's in contact with the litter box that you used, which is hopefully clean, but still, the non-absorbent litter is a special litter that you can put in a clean litter box and wait for the cat to urinate, and then you can syringe out the urine. And these are both considered free catch, and they're both considered not sterile because of the possibility of contamination. Cystocentesis is when we poke the bladder with a syringe, and this is considered a sterile technique. This should be done in a dog that's very calm or sedated, and it can be done with an ultrasound machine to find the bladder first. Bladder expression is when we press on the bladder like this person here is doing to this dachshund, which is very useful in certain patients that can't pee on their own. However, there are certain drawbacks to bladder expression. When we're pressing on the bladder with this pressure, you can cause a rupture of the bladder. If there's some kind of an obstruction, you can cause damage to the urinary tract like bleeding and trauma. And you can also send bacteria that's in the urine back up into the kidneys and cause a kidney infection. And then lastly, we have urinary catheterization, which is also considered sterile. However, like you can see here, this cat has a urinary catheter in. The catheter does have to be placed, so the animal would have to be sedated for that as well. So as far as specimen storage and handling, urine degrades much faster than blood, for example, and urine samples should be run within 30 minutes to an hour. Refrigeration does preserve urine for about 6 to 12 hours. Most labs consider urine not good for urinalysis after 24 hours. Refrigeration can actually cause problems as well, as it can cause crystal formation in the urine. So if you're running a sample that was refrigerated for a while, keep that in mind if you see some crystals. And ideally, obviously, the sample should be run within 30 minutes to an hour, but if you cannot do that, it should be refrigerated so it doesn't break down in the air. If urine is not refrigerated, there are worse complications than refrigerating it. And this is the possibility of bacteria growing in the urine if it's not refrigerated. The glucose and bilirubin levels can be decreased, the pH can become increased, and also any casts or blood cells that were in the urine will start to break down and we won't be able to see them. So anytime you either have a sample that wasn't refrigerated right away, or you have a sample that was refrigerated for over a few hours, you can expect to run into some of these complications when observing the sample and running it. Okay, so the first part of a complete urinalysis is the physical portion, and we're going to talk about that now. Okay, so the physical portion of the urinalysis includes everything that is done without the aid of a microscope or any chemical reagent process. So when we're talking physical, we're talking about the volume. So we're observing and noting the volume of urine. We're noting the color of the urine. We're noting if there's any type of odor. You can see this cat over here is making stinky face at his urine. And then we're looking at the transparency or clarity. Is it cloudy? Is it clear? And then we're also looking at the specific gravity. Okay, so when we're talking about the volume of the urine that's being produced, we have a couple different terms that you need to know. Polyuria. Anytime you see poly, it means many or more. Means that there's increased daily urine production. So we have more urine than normal. And polydipsia usually goes hand in hand with this. Polydipsia is increased water consumption. And when we have the two together, we call it PUPD. And this is the most common symptom associated with diabetes in animals and people. So PUPD is something we see a lot in diabetics. When there's a lot of urine, it's usually pale or light urine, light yellow urine colored with a low specific gravity, usually because it is diluted. This can be associated with nephritis, diabetes mellitus and insipidus, pyometra, and liver disease. It can also be associated with the administration of certain drugs that cause more urination, like diuretics, like Lasix, for example, or steroids, or even IV fluid administration. Oliguria is a term for decreased urine production. So decreased urine production can occur when there's restricted access to water, so they're not drinking enough. It can also cause the urine to be more concentrated. So instead of being diluted when there's more, it's more concentrated. So you can expect a darker colored urine with a high specific gravity. This can be associated with acute nephritis, fever, shock, heart disease, and dehydration. Anuria is when there is no urine being produced whatsoever. This can be due to urethral obstructions, urinary bladder ruptures, and the shutting down of the kidneys. And this is usually a really serious condition because if we're not producing urine, we're not getting the waste out of our body and we can become toxic very quickly. Polyuria is increased frequency of urination. So we're peeing more often. And this is usually associated with things like stones in the bladder, an irritated bladder, or urinary tract infections. So what are some common causes of these conditions? So for polyuria or increased urination, diabetes is a common cause of increased urination. Certain types of kidney disease where the water is not being reabsorbed in the tubules, therefore we have more fluid coming out. Liver disease can cause frequent urination, and also certain types of drugs like steroids and diuretics. For decreased urination or oliguria, certain types of kidney disease can also cause decreased urine. In this case, the kidneys are either retaining water or they're too damaged to produce urine. Hypotension or low blood pressure, dehydration, and heart failure can also cause decreased urine. Anuria, or lack of urine, can be due to an obstruction in the urethral tract. And this is when urine can't flow out, it backs up into the kidneys, and this can lead to cell death. This can be caused by tumors, kidney stones, or male or other growths. In male cats, this is a very common occurrence because they have a narrow urethra and the tubular passage from the urinary bladder to the outside world. Because it is so narrow and any number of things can plug it up, and it's very painful, and it is also a life-threatening emergency. Anything from bladder stones, crystals, mucus plugs, and blood clots can get stuck in the urethra, preventing the cat from emptying his bladder. In this case, in this x-ray, you can see that this bladder is filled with stones, and we probably have a stone or a crystal blocking the urethra, and the urine cannot leave the body, and the bladder is filling up. And again, this is very common in male cats. And for increased urination of frequency, polyuria, when there's increased frequency, that is usually due to infections or UTIs, bacterial infections, also diabetes, cancer, stones. So they're peeing more probably because they can't empty the bladder. So we have little bits of urine coming out all the time because the bladder is having trouble emptying. Liver failure, and also a condition called FIC, which is feline idiopathic cystitis. Okay, so for urine volume, we want to be able to determine if an amount is too much. So is this animal producing more than normal amount of urine or less? So we have to know what normal is. And the normal amount of urine for animals and domestic species works out to be 1 to 2 milliliters of urine per kilogram of weight per day. And down below we have a table here with some ranges. Remember, these are ranges. They're going to vary for the animal and also for species. You can see that dogs and cats give about 20 to 40 milliliters of urine per kilogram of their weight per day. And cattle are very similar, so are the goats. And then horses have significantly less urine production. And remember, this is related to the amount of fluid they're taking in. So their ins and outs. So the amount of fluid they're taking in is definitely proportional to the amount that they are excreting out. This is especially important with animals that are in renal failure. You want to make sure that their kidneys are producing urine, or obstructed animals. And we can measure the amount of urine in a catheterized animal, for example. We can measure the fluids, the IV fluids that we're giving them, and then we can also measure the fluid that they're producing that come out in the bag. So if you can't measure it exactly, usually we know how much our pets go to the bathroom, and you keep visual record and observations. So this number right here is important, and try to remember this, that the normal daily urine production for domestic species is 1 to 2 milliliters per kilogram of weight per day. The first thing that we evaluate in the physical portion of the urinalysis is the color. Normal urine is a yellow, light yellow to straw amber color. This is normal urine all the way here on the right. And if we're overhydrated, it's going to be pale yellow. And if we're dehydrated, it's going to be concentrated and be a darker yellow. Urine can range anywhere from yellow to orange to red to brown, depending on its contents and its concentration/dilution. The yellow color of urine comes from urochromes, which are a pigment in urine, also known as urobilin. It's a byproduct of the breakdown of hemoglobin and bile. And when it is exposed to air, it is oxidized, which gives it that yellow color. When urine is red, it's usually hematuria. Even though certain drugs can change the color of urine, certain drugs can cause urine to appear red or orange or even brown. Hematuria usually produces the reddish color. Now, this is due to red blood cells. And When you spin down a sample like this, the supernatant may appear straw colored, and all of the red blood cells will be down in the sediment plug. So it's important to evaluate the urine before it is spun down. Hematuria is usually caused by trauma, hemorrhage, inflammation, presence of stones, or cancer. It can also be a symptom of UTIs or more serious disorders like urinary tract cancers. However, again, the most common cause are usually UTIs, stones, and crystals. Hemoglobinuria is when we have hemoglobin specifically in the blood. So, not just blood, but hemoglobin specifically. This indicates that there is intravascular hemolysis with subsequent filtration of the hemoglobin into the tubules. The supernatant appears red, and the plasma color is pink to red for the blood. Hemoglobinuria can be caused by diseases such as sickle cell anemia and thalassemia, IMHA, staph or strep infections in the bladder, toxins, and kidney infections. Myoglobin is a protein found in the muscles of vertebrates. And when myoglobin is in the urine, it can cause the urine to appear brown. It's specifically found in the heart and skeletal muscles. It's a dark red hemoprotein that binds to oxygen and iron and is a member of the superglobin family of proteins. So, just like hemoglobin, myoglobin is a protein. Its main function is to supply oxygen to muscle cells or myocytes, which helps them contract and relax. It can also help break down nitric acid into nitrate, which allows mitochondria to access oxygen. Hemoglobin is found in red blood cells, while myoglobin is found in muscle tissue. Hemoglobin carries oxygen from the lungs to the body's tissue, while myoglobin stores oxygen in muscle cells for use during activity. Myoglobin has more of an affinity for oxygen compared to hemoglobin, and as a result, it can acquire oxygen from hemoglobin, hence transferring it from the blood to the muscles. Myoglobinuria occurs when muscle cells are damaged and they release myoglobin into the bloodstream. This may occur after severe myopathies. The urine may appear brown, and often a few red blood cells are present. The supernatant will appear clear when spun down, and plasma is going to appear pink to red in the blood. Myoglobin in the urine is usually a sign of trauma like rhabdomyolysis. The myoglobin is excreted during conditions that cause muscle cell lysis. Rhabdomyolysis is extremely common in horses because, especially like a racehorse that's forced to exert itself, and another cause of myoglobinuria is necrosis of skeletal muscles from genetics, certain draft horses, or from poor training. When the body doesn't get enough oxygen, it breaks down muscle. And muscle death occurs and releases toxins into the blood that can cause renal failure. So here we have a table of some of the contents of urine that may cause the coloring. And you notice here that urine can also have an orange color due to bilirubin. And then we have a nice little chart over here that shows what some of these colors may be related to. And again, normal is pale yellow. Clear can indicate overhydration or kidneys not functioning, not filtering the blood. Dark yellow can be related to dehydration. So our urine's very concentrated. It's mostly sediment probably and not enough water. Red or pink is usually related to hematuria. Green can be related to certain types of infections. Brown, again, is usually related to myoglobinuria. And then they didn't include orange here, but orange can be related to bilirubin in the urine. Another thing to note is that when we're looking at the color, we also are going to note the clarity. Is it clear? Is it cloudy? And we're going to talk more about that in a minute. Another part of the physical portion of the urinalysis is observing if the urine has any odor. Although this is not highly diagnostic, it is definitely helpful in certain situations. If, for example, urine has ammonia odor, that could be caused by certain bacteria, and also an increased pH, which goes hand in hand because we know that certain bacteria will make urine more alkaline if there's a presence in the urine. Urine can also have an ammonia smell when it's left out too long. As we know, it breaks down very quickly out in the air. And then if urine has a sweet odor, this is usually related to ketones, which can be seen in diabetes, mellitus, ketosis in cows, and certain pregnancy diseases in sheep. And this has like kind of a smell that is very sweet. Some people say it's like a nail salon type smell. Um, and then also some people do not have the ability to actually pick up this scent in their nose. Once we've noted the color of the urine and any possible odor, we're going to look at the clarity. Now, you can hold up this, it should be in a clear container when you're doing this, and also you can hold up the urine to something with writing on it and see if you can read the writing through the urine. Normal urine in most species is going to be clear. Exceptions are horses and rabbits. Horses and rabbits have cloudy urine due to calcium carbonate crystals and mucus in their urine. It's normal for them. However, everyone else's urine, like dogs and cats, should be clear. When we're looking at clear urine, there's usually no sediment in it. It's healthy urine. Cloudy is kind of the next step up. So if you're looking through the urine and it seems kind of cloudy, but it's not totally opaque, so we can still kind of see through it. It just looks a little cloudy. That is usually, anytime we have any cloudiness to the urine at all, it can be due to different things. So it usually means that there's sediment of some kind that's not supposed to be in the urine, whether it be cells or casts or crystals or bacteria floating around. It can be due to mucus or fat. And then we have foamy urine. So you can actually see in this picture, this urine has foam at the top. This is usually due to protein. And then turbid urine is when it's so thick that you just can't see through it at all. And that's kind of what we have here on the right. This urine is not only turbid, but it is also foamy. The last part of the physical portion of the urinalysis is the specific gravity. And to measure this, we use the refractometer, which is the instrument you see on the right. We place a drop of urine on the window and we close the door of the refractometer, usually aim it at a light source, and you can focus the ocular piece and you take a reading on the inside scale, which we're going to look at in a second. So specific gravity can be abbreviated SG for specific gravity. You may see it as USG also when you look at the scale inside the refractometer. And what it is it's a measure of the urine concentration. So how dilute or concentrated is the urine? If we are dehydrated, our urine's probably going to be very concentrated. It may be a dark yellow looking, and we're going to have a high specific gravity. If we're overhydrated, our urine's probably going to be diluted, and we're going to have a low specific gravity. A high specific gravity can also have to do with kidney function. So if we're not eliminating enough water, the urine's going to be concentrated. And also, if the urine is too dilute, the kidney may be losing too much water and not reabsorbing the amount that it's supposed to be reabsorbing. So due to different ins and outs of the body, this can change many times during the day, our urine specific gravity reading. And it is most concentrated in the morning when we wake up and we haven't urinated for a while. So this is going to be the most accurate time or the best idea of how concentrated our urine can get in a morning sample. But again, due to how much we've urinated or drank during the day, it changes. So there's a wide range of what is considered normal. This part of the urinalysis can be performed before or after centrifuging the sample, so it can be done on whole urine or the supernatant. There's studies on this, and some people feel it's more accurate whole urine because we have the whole picture there, but then other people think that once you have the supernatant, all the sediment that could possibly cloud the measurement is out of the urine. But studies show that the measurement is usually the same whether it's on whole urine or the urine that's been spun down, the supernatant. Specific gravity is something that can tell us a lot about the kidney, so we want to make sure that it's accurate. The reagent strips also have a little square that reads specific gravity. However, it is not considered very accurate in comparison to the reading that we get from the refractometer. So when you look through the eyepiece of the refractometer, this is what you're going to see, this scale inside. And there are many different types of refractometers in many different industries, but in vet and med, the two scales that you're going to see inside a refractometer are the SP or TP, total protein, total solids. It all means the same thing, and that's what we read off the PCV tube when we break it in half. And then you're going to have your USG or SG or urine specific gravity on the right. And that scale starts off at 1.000 and it usually goes to 1.05. Depending on the maker, these scales may go higher or lower on how much they want to put on their scale. But it starts off at 1 because that is the specific gravity of distilled water, and that's what we use to calibrate the refractometer. And let's look at some of the different reference ranges for different species. So cats generally have a higher specific gravity than dogs, and this is normal for them. They also drink less water, and they're also prone to kidney disease. And then horses, remember they have cloudy urine. They also have a higher specific gravity in general. Cats and horses have a lot of similarities. It's kind of strange. And then let's talk about how you read it. So when you're looking at the scale, you're going to read the measurement for both the total protein and the specific gravity, where the white meets the blue. So where this line is, that's where you get your reading. So for this patient, the urine specific gravity in this case looks like it's 1.035. And again, as we discussed on the slide before, an increased specific gravity. So how much stuff is in that urine? How concentrated is it compared to the water? An increased specific gravity with a lot of stuff can be related to decreased water intake, dehydration, fluid loss through sweating or panting or diarrhea, acute renal failure, or shock. And then a low or decreased specific gravity where we have a dilute urine and the stuff in it is very low compared to the amount of fluid could be related to increased water intake, excessive fluid administration, pyometra, liver diseases, certain renal diseases as well, and diuretic therapy. So 3 terms that we're going to talk about some more here are hyperthernuria, hypocynuria, and isothernuria. So hyper is when we have an increase in urine specific gravity from what is normal. Hypo, again, always means low, so where then there's a decrease in the urine specific gravity. And then isothernuria is when the urine specific gravity is almost equal to the glomerular filtration rate, which we're going to talk about more in a second. But basically how the kidneys are working to filter the waste out of the blood, that's what a GFR is. Because specific gravity is such a good indicator of kidney function, we use it alongside chemistry assays to evaluate the kidneys. The BUN and the creatinine and the GFR, which we'll talk more about in our chemistry lecture. The glomerular filtration rate, or GFR, is a blood test that measures how well your kidneys are working by estimating how much blood passes through the glomeruli each minute. Remember, the glomerulus is part of the nephron that filters the blood. Glomerular filtrate is the fluid that's filtered out of the body during this process. The specific gravity of that filtrate ranges from 1.008 to 1.012. Any measurement below this range indicates hydration, and any measurement above it indicates relative dehydration. So normal urine can be hypocyanuric, isothanuric, or hypercyanuric, depending on its specific gravity relative to the specific gravity of the filtrate. Hypocyanuria is when the urine specific gravity is less than the range of the filtrate, and hypocyanuric urine has a lower osmolality than the plasma. So it's diluted compared to the plasma. It's lower than the specific gravity is lower than that of the filtrate, and this can indicate hydration, for example. And then isocyanuria is when the urine specific gravity is equal to the range of the filtrate. And it usually stays about 1.001, whether the body's being hydrated or not, it doesn't change. This condition happens when the kidneys are unable to concentrate or dilute urine, and it can be a sign of kidney damage, chronic renal failure, for example. the urine specific gravity is going to be equal to the specific gravity of the filtrate. And then hypersonuria is when the urine specific gravity is greater than that range, and it has a higher total solute concentration than the filtrate. So we're more concentrated than the filtrate. And an example of why you would get this is when you're dehydrated, your urine would be more concentrated than your blood. Okay, so that concludes the physical portion of the urinalysis, and we're going to move on and talk about the chemical portion. The chemical portion mostly comprises the reagent strip, which you're looking at up here. But there are some other tests involved, especially if we're talking about a specialty laboratory, not just an in-house urinalysis. So this is the typical urine strip container. This is what it's going to look like, and it has this chart on the outside that has different colors that you're going to compare your strip to. These strips are very sensitive to air and light, so you always want to keep them inside the container with the cap tightly closed, and take it out when you're going to use it and make sure you close it again and keep it at room temperature. So the way that we want to do these strips is you want to submerge them completely in the urine. That is the correct way to do it. If you don't have a lot of urine, you can drip like a little drop on each square to try and get a reading, but that is not as accurate as submerging the entire strip. And this is why labs ask for like 5 mLs of urine, like for example, if you're sending something to IDEX, because the correct way to do it is to submerge it. Now, some machines nowadays, like the SediVue, for example, will analyze the strip for you. They'll even look at the urine sediment for you. But the elements that are on the strip, these are chemical reactions that take place on the urinalysis strip when it contacts the urine. And then we hold up our strip to the side of the bottle here, and we read and find out. So, for example, if you're looking at protein, you'd follow it across and match the color. And the strips read pH, they read protein, they read glucose, ketones, bilirubin, urobilinogen, blood, leukocytes. And again, when we're talking about blood, that's mostly red blood cells, whereas leukocytes are specifically white blood cells, nitrates, and specific gravity. And like we discussed before, the strips are not really accurate for specific gravity, so you always want to double check a specific gravity with your refractometer. Okay, so here's the chart that's on the side of the bottle that you're going to line your strip up with. And you're going to notice that all of the different values finish their reaction at different times. So the leukocytes take longer to change color than some of the other ones. But after 2 minutes, everything should be changed. But you read everything when it says to read it. So at 60 seconds, you would read the protein. And usually we'll have like a sheet that we're going to fill out as we're looking at the strip. So you put your strip up here, and if this green is the same as this green, then we're negative for protein. And before you do the strip, you already have the knowledge of the physical part. So if we know that the urine is bloody or red, we can expect to see blood in the urine. We can expect this to change here. If we suspect that the patient has a UTI, we'd be looking at the leukocytes and the nitrates. If the urine is cloudy, we might expect to find protein, for example. And remember that you're going to note what the specific gravity says on the strip here, but we're going to double check it and match it with what we get on the refractometer. The first property we're going to discuss on the reagent strip is the pH, which also stands for the potential of hydrogen, and defines the either acidity or alkalinity of the urine. So the pH scale is 0 to 14. 7 is the pH of water. Anything below 7 is considered acidic, and anything above 7 is considered basic or alkaline. Many things can affect the pH. The kidneys are involved in acid-base balance. The pH is affected by diet. It's affected by medications. So anything that is going into the body. Acidic urine usually occurs from a high protein diet, so this is common in carnivores. We can have an acidic urine with fever or starvation or acidosis. Alkaline urine or more basic urine occurs in herbivores, in high fiber diets, and it can also happen with UTIs due to the bacteria. urine retention, and also in a condition called alkalosis. So we discussed herbivores are more likely to have alkaline urine and carnivores are more likely to have acidic urine. Omnivores who eat both, it really depends on what they're ingesting. When the urine becomes too acidic or too alkaline, this can result in different types of crystals or uroliths. Uroliths is another word for stones. So the different types of stones, depending on what they're comprised of, form in different types of urine. So some crystals or stones form in acidic urine and some form in alkaline urine, depending on what they are made of. Diets, special veterinary prescribed diets can be used to control or dissolve uroliths by either making them more soluble or taking out some of the elements or minerals that are comprising the uroliths, basically putting in constriction on the intake and the amount of those, like calcium oxalate. The diet may have less calcium, for example. And also help to prevent the formation of different stones. By changing the diet, we change what is occurring in the body. Now, a situation called acidosis is when the body fluids and tissues are acidic. And then alkalosis is when the bodily fluids and tissues are more basic. Protein is another thing measured on the reagent strip. It is normal to not have any protein present in the urine or less than 30 milligrams per deciliter of protein. So the reagent strip doesn't measure anything less than that. It counts it as absent. But when there is proteinuria or protein in the urine, the strip will change color. Now, this can be due to several things like blood in the urine because blood has proteins in it, urinary tract infections, crystalluria, and kidney disease. In kidney disease, we lose some proteins that are supposed to be reabsorbed in the tubules but are not correctly reabsorbed back into the body. And on the right here, I just have a picture of some bacteria in urine. You can see the bacteria, these little rods, and there's a lot here. So we're expect to see protein in this sample. And then this urine over here has that frothy, foamy appearance, almost looks like beer. And this sample will most likely also be positive for protein. Some additional tests may be used to further examine the protein in the urine. A microalbuminuria test detects very small amounts of protein in a pet's urine. It's more sensitive than the urine dipstick and can be used as a screening method for kidney disease, for early kidney disease. A urine protein to creatinine ratio test measures how much protein is lost through a pet's kidneys, and they can help determine if the loss is a health risk. The test involves measuring the amount of protein and creatinine in the same urine sample and expressing the ratio between the two. Is most often sent to a lab, these tests. Some chemistry analyzers in-house can do this on the urine. Another test we can use is the sulfosalicylic acid test, which I'm going to demonstrate in a little video on the next slide. But it is basically to, much like we double check the specific gravity with the refractometer, the sulfosalicylic acid precipitation test can be used to double check the presence of protein on the strip. And we also have something called an ERD, or early renal detection kit, which you're seeing in the picture, which can help to monitor renal disease. It is a screening test for microalbuminuria, or very small amounts of albumin in the urine. It detects and monitors ongoing nephron damage in dogs. The problem with kidney disease is that 75% of the nephrons must be damaged before it shows up in blood work, like on a creatinine or BUN in a chemistry. So it's important to monitor blood work and other tests as animals age to watch trends before it's too late. Some other blood work tests that can help monitor early renal disease are the SDMA, another chemistry test, and the renal tech for cats. Another thing the strip measures is glucose. When glucose is in the urine, we call it glucosuria. This is caused when the tubular resorption cannot keep up with the glomerular filtration because of hyperglycemia. So there's so much glucose in the blood, and the kidney's filtering it and can't reabsorb it fast enough, so it comes out in the urine. So we have glucose in the blood and in the urine. And again, this is seen with diabetes mellitus, along with PUPD and inappropriate urination. It can also be seen if a patient just ate a high carbohydrate meal, and it can also be seen in cats. Their blood glucose goes up when they're stressed, like being restrained at the vet, for example. Ketones are also measured on the urinalysis strip. There are also special sticks that measure only ketones. They're called keto sticks in urine. And if you wanted to double check your reagent strips, you could pull one of these out. Ketones are a type of chemical that your liver produces when it breaks down fat. Your body uses ketones for energy typically when you're fasting or you're exercising for long periods of time, basically when you don't have a lot of carbohydrates or sugars. Ketones are toxic and they can cause central nervous system depression and acidosis. Ketoacidosis is a situation that results from high levels of ketones in the blood, and the blood becomes acidotic. There are also high concentrations of ketones in the urine during ketoacidosis. Ketonuria is when we have ketones in the urine. It is seen in conditions where the body is using excess ketones as an indication that it's looking for an alternative source of energy. It's seen during starvation, long-term anorexia, could be seen with high-fat diets, typically seen with diabetes mellitus, and also in liver disease. The liver stores glycogen, which is a form of glucose. And when glycogen can't be stored properly, disease can develop, and it forces the liver to use other sources than glycogen for energy. This also causes ketones to be expelled in the urine. Urobilinogen and bilirubin are two bile pigments that are tested for on the reagent strip. Urobilinogen is colorless, water-soluble, a bile pigment that is produced when the intestines break down bilirubin. Bilirubin is a yellow substance that the body creates when it breaks down red blood cells. The liver uses bilirubin to make bile, which aids in digestion. Good bacteria in the intestines break down the bilirubin in bile to produce urobilinogen. It is normal for trace amounts of bilirubin and urobilinogen to be in urine in dogs and cattle. It is not normal in cats, horses, pigs, and sheep, and it is a serious issue in cats. Bilirubinuria is the term for bilirubin in the urine, and urobilinogenuria is the term for urobilinogen in the urine. These things can be caused by liver disease, the obstruction of bile flow from the liver to the small intestines. If there's an obstruction in the biliary tract, the bilirubin accumulates in the hepatic cells and then flows over into the bloodstream and then is excreted in the urine. In hemolytic anemia, we can also see these things in the urine. It's caused by a large amount of hemoglobin being released due to the destruction of red blood cells in the anemias. And also we can see these things with certain drugs and toxicities. If you look to the right here, we have two pictures. One is of a confirmatory test for bilirubin. In this test, the tablets placed on a pad and distilled water and the urine sample are added, and a purple color change will indicate positive for bilirubin. When the bilirubin is positive on your reagent strip, you may also see bilirubin crystals, which are brown, spiky-looking crystals. On the reagent strip, there is a square labeled blood. This square can pick up the presence of red blood cells, hemoglobin, and myoglobin. So certain things must be done to the sample, like centrifugation and examining the actual urine sediment under a slide to tell what it's testing positive for. It can be hematuria, or the presence of intact red blood cells, so whole cells, and By the way, red blood cells, this is what they look like in urine unstained. They look like little donuts, little tiny circles. This is the needle, and in comparison to them, this is the size that they would be under the microscope. When we have whole red blood cells in the urine and we spin it down, the urine may appear red at first, but if they're whole red blood cells, they're going to separate out during and after being centrifuged, and then we're going to have them just down in the pellet where all of the sediment is, and the regular urine will not appear blood because that pigment is all inside the cells. This can be caused by urine collection, so cystocentesis could cause blood in the urine. We're still poking the bladder with a needle. Taking urine using a catheter because we're, inside, possibly causing trauma to the urinary tract. And then also bladder expression can cause hematuria in the urine. So pretty much the only method of urine collection that doesn't possibly cause hematuria is avoided or free catch. Usually when there's hematuria present, it is signaling that there is bleeding somewhere in the urogenital tract. Hemoglobinuria is when we have specifically hemoglobin in the urine. And in this case, when you spin it down, because the pigment is already outside of lysed or broken cells, the urine is still going to appear red after being centrifuged. When there's hemoglobin in the urine, it's usually due to the fact of some kind of intravascular hemolysis, meaning that the red blood cells are being broken down in the veins way before they get to the urine. Myoglobinuria is the presence of myoglobin in the urine. As we discussed, this may appear more brown than red, even dark brown to black. And this is due to the presence of myoglobin, which is that protein that's in muscle cells, and it's due to the breakdown of muscle cells when it winds up in urine in certain situations like we discussed earlier, like rhabdomyolysis. So because the strip can turn positive for any one of these three, it is very important not only to examine it after you centrifuge it, but also to examine the sediment. And again, this is what specifically red blood cells would look like under the microscope. Another spot on our reagent strip is for leukocytes, so specifically for white blood cells. The reagent strip is not considered very accurate for leukocytes, and you can get a lot of false negatives and false positives. So this is another one where we want to make sure we do the microscopic evaluation of the sediment. As you can see on the right, this is an unstained slide of urine, and these are white blood cells. The white blood cells, you kind of can faintly see the nucleus, but you can't really make it out, and they're going to be twice the size, 1.5 times to twice the size of red blood cells. So we have, in this slide, we have some crenated red blood cells in between the white blood cells, which are slightly bigger. Most white blood cells in urine are going to be neutrophils, since that is the most numerous white blood cell. And when we have leukocytes in the urine, it is most often associated with urinary tract infections or UTIs. When there are white blood cells in the urine, we call it pyuria. When examining specifically for white blood cells, this is an instance where you would want to use SETI stain because cells are going to be easier to see when they're stained. White blood cells and red blood cells may lyse in very dilute or highly alkaline urine. Usually 0 to 5 white blood cells per high power field. So the one field that you're looking at through the microscope, if you see 0 to 5 white blood cells or red blood cells, that's usually considered normal in urine. Anything greater than that is considered pyuria. And depending on clinical signs, even if we have white blood cells and no bacteria present, it could be a sign that we should run a urine culture. However, most often when you have the white blood cells in excess like this, you will also see bacteria. And nitrates. Nitrates are also one of the squares on the reagent strip. Nitrates are a type of nitrogen chemical that are naturally present in healthy urine. The most common cause of nitraturia is a urinary tract infection. So if we have a UTI, we're most often going to see the nitrates become positive on the strip, also the leukocytes, and possibly even the blood square. So the most common cause of nitrates is UTIs, and it can be caused by bacteria in the urinary system, which breaks down nitrogen waste into nitrates. Some type of bacteria have an enzyme that converts nitrates into nitrites, which are in abnormal presence in urine. And our third part of the urinalysis is our microscopic or sediment evaluation. Now that we've got our physical portion and our chemical portion behind us, we have a lot of information to go into this part. So when we make our slide, we know what we might expect to see and what we should be looking for. Okay, so now we have to prepare a slide to examine for sediment. The first thing we're going to do is centrifuge our sample, and as you can see, we use these conical looking tubes because the sediment more easily forms at the bottom of these tubes due to the shape. So we're going to centrifuge our urine for 3 to 5 minutes, generally at a speed anywhere from 1,000 to 2,000, 3,000 RPMs or rotation per minute. And after 3 to 5 minutes, we're going to take it out of the centrifuge. And the speed and time will vary on who you talk to, so that's why there's a range. And once it's spun down, you're going to be able to see the separation between what we call the sediment plug, and you'll see kind of like a diagonal line where the sediment ends, and then the rest of the fluid remaining is the supernatant. And that's what we've been referring to in this lecture. So at this point, you pour off the supernatant. I personally recommend pouring this into another sterile container in case your doctor wants to send out some more tests, or just dump it out if you know that they won't want it. But in any case, you pour it off, and then you're left with about 0.5 mLs to 1 mLs of fluid and sediment at the bottom. And we're going to stir that up so that it's a more accurate representation of what's going on in the urine. So you need to stir this. You could use a wooden dowel or a pipette. And then once we stir it and it's properly mixed, gently stir just so we're not crushing any debris that we may want to see. And then you're going to use a pipette to transfer a drop of this to a slide, a glass slide, and you're going to put a cover slip over it. Okay, so let's just go over some of the details of this technique. All urine needs to be centrifuged for the microscopic portion. We're generally about 3 to 5 minutes in the centrifuge with a speed of 1,000 to 2,000 RPMs. You're going to pour off the supernatant at that point, should leave you with 0.5 to 1 mLs of fluid with sediment. We mix that up at that point, and then we place a drop on the slide. As you can see here on the bottom, we have what we call like a dual slide. There's 2 different cover slips here. This is plain urine, and then this is urine with SETI stain. So the first thing you want to do is place a drop of urine on the left here and put a cover slip over that, and that will be your unstained urine. And as you're going to see, things look much different in unstained urine than they do in stained urine. And then if you're going to use the SETI stain to look for something particular, you place 1 drop of stain in that urine that's at the bottom of the tube, and you mix it again, and then you take a drop and put that on the right side with another cover slip. All right, so normal urine in a healthy patient is not going to have much in it. You're not going to see too many cells. Per high power field, you should see 0 to 5 white blood cells, red blood cells, epithelial cells, maybe 1 crystal on the entire slide or cast. Sperm is possible to see in a normal patient if it's an intact male or recently bred female. And then abnormal is when we're talking about cells more than 5 in a high power field, a handful to a whole slide full of crystals, casts, lots of casts. Any cast is abnormal. We don't really see that in normal urine. You may see parasites like parasitic ova or even worms, bacteria if we have a UTI going on, and you can also see yeast. And you can see this is unstained urine and this is stained urine. And just about the sediment, again, real quick, these are some of the things that you can see. It is very important to do the sediment analysis because a lot of things cannot be detected that we're looking for, like casts and crystals and microorganisms on our reagent strip, or by simply looking at the urine. When we look at the urine under the microscope, we're using the 10x or 40x objective. And if we're looking at unstained urine, we want our light supply to be very low. So you're going to turn the light down very low, and you're going to be on the 10x or 40x objective. We want the freshest urine possible so that none of the components have degraded. And we also would prefer a first morning sample, again, like the specific gravity. We want the most concentrated sample so we can see what's going on in there. And some of the things that we may see are cells. And again, erythrocytes or red blood cells, white blood cells, and epithelial cells. 0 to 5 per high power field is pretty normal. Anything more than that, we can start considering abnormal. And casts, we really don't see casts in normal urine. You know, if you see one, that's rare. It's more something that happens with kidney disease. Crystals are considered abnormal. 1 or 2 in a slide is usually no big deal, but usually when we have crystals, there are numerous crystals as well. Microorganisms like bacteria, and then there's also some artifacts that we can see in urine. Urine is actually really interesting to look at under the microscope, and you can even see different types of plant materials. So there's some things that are in urine but aren't necessarily clinically important. Okay, so if we see red blood cells in urine, we kind of discussed this a little bit already, but it usually indicates that there's bleeding or some kind of trauma in the urinary tract. And that can be from obtaining the urine sample, depending on how we did it. The appearance of red blood cells means hematuria. Remember, so we can separate them out, and we know that it's hematuria because there are red blood cells. Concentrated urine causes red blood cells to shrink and crenate. So kind of like we saw in that other slide, they have these ruffled edges. So if the urine's really concentrated or if it's really dilute, the red blood cells may look different. So if it's concentrated, they may shrink and crenate. If it's dilute, it causes red blood cells to swell and lyse or break open. If the urine is very basic or alkaline, the urine may also cause the red blood cells to swell and lyse. And you can take a look here again. The red blood cells, unstained, look like little yellow donuts with a little circle in the center or a dot in the center. And then up top with the stain, they look kind of blue or purplish. Another thing that can affect the way the red blood cells look is the freshness or the time that we collected it to the time that we're actually examining it. At first, the red blood cells are going to be round and smooth and somewhat refractile, meaning you'll see a little refraction of light, and then they have this yellow orangey color. When we see white blood cells in the urine, remember they're 1.5 to 2 times the size of the red blood cells, and they're mostly going to be neutrophils. So you can see here we have a red blood cell, and then this is a white blood cell. So they're going to appear spherical. They're going to be bigger than the erythrocytes. You sometimes can see granules and the lobes of the nucleus. It is kind of hard to identify particular white blood cells, but it is easy to tell the difference between white blood cells and red blood cells. These cells are also affected by the concentration. So if the urine's really concentrated, the white blood cells also may crenate. And if it's dilute, they also may lyse. Again, 0 to 5 per high power field is normal. You can see in this picture, there's more than 0 to 5 just in this small little area. I counted at least 6. So we're already looking at abnormal. Plus we have red blood cells and what looks like possible fat droplets and bacteria in here. So this sample is definitely not normal. And down here, I just have a drawing that shows kind of the difference between the size of the red blood cells and the white blood cells. When we have excessive white blood cells in the urine, it's referred to as pyuria. We mentioned that term before, and this is usually related to a UTI, or the presence of bacteria in the urine, or some kind of inflammatory process. And if we're seeing this in the urine, this urine should definitely be cultured so we can find out what type of organism is causing the infection, and we can prescribe antibiotics. Okay, so we're going to talk about epithelial cells. Epithelial cells in urine, there are 3 different kinds. We have the squamous, the transitional, and the renal. The squamous ones are normal. It's normal to see 0 to 5 of these. Again, they are large. They can have square-looking edges. They sometimes fold upon themselves, and they can take up a big portion of your high power field. This is a stained squamous epithelial cell. They exist all along the lining of the urethral tract, the urethra, the vagina, the vulva, and the prepuce. So again, if they slough off, especially in a voided sample, this is pretty normal, and it can be considered contamination of a normal sample, but again, they are pretty normal to see. So it's usually not very significant in a voided sample. However, in some cases, they can be related to UTIs and other kidney issues. The second kind of epithelial cell in urine is transitional epithelial cells. They're kind of pear-shaped, and you can see that they have a pretty large nucleus as well. Here's the unstained, and here's the stained. They are granular as well, so you may be able to see granules within the cytoplasm of the cell. 0 to 1 per high power field of these is normal. Any more than that is considered abnormal. These are protective coating in the bladder, ureters, renal pelvis, and urethra. If we see increased numbers of transitional epithelial cells, this can indicate cystitis, or inflammation of the bladder, cancer, injury to the urinary tract, like from using a urinary catheter, for example, and also pyelonephritis, which is an inflammation of the kidney and renal pelvis. The last type of epithelial cell that we're going to talk about is the renal epithelial cell. And as you can see on the right here, there's a nice comparison of the 3 types. The squamous are extremely large and have some straight edges. The transitional are round or pear-shaped. And then the renal are smaller than both of these. They have a nucleus. They are slightly bigger than white blood cells. Renal epithelial cells are found in the renal tubules. Again, they're slightly larger than white blood cells and sometimes confused with white blood cells. They do look a little bit like a reactive lymphocyte, maybe. They're non-granular or slightly granular, so you probably won't see too many granules in the cytoplasm. Renal epithelial cells are abnormal. So they usually suggest some kind of kidney disease in the parenchyma of the kidney. With kidney disease, the renal tubular epithelial cells, so the renal epithelial cells in the kidney's tubules, which filter the blood, a finding of these in urine sediment can be more significant than any other type of epithelial cell. And more than 15 of these per high power field could indicate serious kidney problems such as CKD, or chronic kidney disease, or acute kidney injury. Okay, so one of the other things we can see in urine is casts. So if you remember the nephron again, the urinary casts are formed in the nephron's distal tubule. What happens is there's a protein in the tubules called the TAM horsefall mucoprotein. It's excreted there, and it acts almost like a gelatin, and it aggregates and pulls all the sediment together in the tubules, and it makes a mold of the tubules, and that's why they got the name cast. As it aggregates, the little tube mold can pull in cells, bile, hemoglobin, albumin, and other proteins to adhere to it. So depending on what is in the cast is how it's classified and named. There are a few different types we're going to talk about. These also can be dissolved in alkaline urine. So, for example, in herbivores, you may not be able to see them. And again, we should be looking at fresh urine whenever we are looking for casts. So here's a breakdown of some of the different casts you may see. The hyaline cast is essentially an empty cast. It's like an empty shell. A granular cast has granules in it, and they can be coarse or they can be fine with only a few granules or condensed granules. Waxy casts have a waxy appearance. They almost look like they've been shaved off the side of a candle. We could have red blood cell casts that have red blood cells in the tube mold. We can have white blood cell casts. We can have epithelial cell casts. We can also have a mixture. For example, we have one here it's a hyaline, so it's mostly empty, but there's a few scattered red blood cells in there. Another thing that can be in casts is fat, so we can have a fatty cast as well. So hyaline casts are clear and colorless, and they consist only of the TAM horsefoal protein. So there's no other elements inside of them unless it's a combination cast. A hyaline cast alone is empty. A few of these are normal. They are hard to see because they're clear. So you do want to keep the light very low. Increased numbers indicate mild renal irritation or tubular damage and can also indicate early kidney disease. Waxy casts are wider than hyaline casts, and they have kind of square edges, and they sometimes have little indents on the side as well. These are seen with chronic severe degeneration of the renal tubules, advanced kidney disease, long-term kidney failure. They appear very refractile as well, so they're going to refract light, and again, they look like a shaving from a candle. So even though these two look similar, one indicates very early or mild kidney damage or nothing at all, whereas the other one indicates severe kidney damage. Fatty casts contain small fat droplets, so they will appear refractile. They can be seen in cats with kidney disease. They're also seen when there are high lipids in the body, in the urine. This is most often a complication of kidney disease. Dogs with diabetes can have these, and it suggests that there's degeneration of the renal tubules. Granular casts are made up of granules. The granules are comprised of the breakdown of the cellular content and are usually present with kidney disease as well. The granulation, again, can be fine to coarse, and these casts usually have a yellow to brown color. They're also the most common casts that you'll see in urine. An increased number of these can indicate more severe renal damage. Cellular casts contain cells, so they can contain red blood cells, white blood cells, or epithelial cells, depending on what's going on in the patient. The cells can be present due to damage in the kidneys, infections, or even cancer. The cells are grouped inside the tubule-shaped cast when the protein aggregates, and depending on what's there, it pulls it into the cast. Epithelial casts are often seen with acute nephritis. They can be there due to trauma, renal tubule sloughing. White blood cell casts usually, again, are mostly neutrophils, and they can be seen with inflammation of the renal tubules. Red blood cell casts, again, usually have a yellow to orange color, and they're usually seen when there is bleeding in the kidney, whether it's from trauma, hemorrhaging, inflammation, or bleeding disorders. Another thing we may see in urine is crystals. When crystals are in the urine, we call it crystalluria. And although most of the time crystals may or may not be clinically significant, they can be due to different human error type things. They can lead to stones, especially certain kinds of crystals can form uroliths or stones in the bladder. They can also lead to blockages where the patient cannot urinate. Stone analysis are done by labs. So once we recover a stone from a patient's bladder, they would be sent out to a lab to assess their chemical composition. And this is how we treat the formation of stones, by knowing the chemical composition. And one of the ways that they can be treated is through veterinary diets. For example, if a patient had struvite crystals, like the one on the right here, the diet would have a reduction in magnesium, phosphorus, and protein. This diet also helps to acidify and dilute the urine. Dysuria is painful urination, and this can definitely be due to stones in the urinary tract. Three most common types of crystals that you'll see in vet med are struvites, like the one on the right here, calcium oxalates, and urates. All of these have the ability to form stones. The crystal type that we're going to see in urine is going to depend on the pH of the urine, the solubility of the elements. These elements that form the crystals are less soluble at lower temperatures. So for example, if we're refrigerating a sample, it's more likely to develop crystals falsely. So when you take a sample out to analyze it's been in the refrigerator, it's a good idea to let it warm to room temperature so that those crystals can be dissolved. So here I have a drawing of different crystals that you may see in the urine. And we're not going to talk about all of these, but I just want you to be aware of some of the names. So we have tyrosine, leucine. You can have amorphous crystals that really don't have a shape, and these are probably due to refrigeration or something like that. Calcium carbonate, calcium phosphates, bilirubin, remember we talked about those before, calcium oxalates, uric acid or urates, cholesterol crystals, calcium oxalate monohydrate, ammonium biurate, cysteine, hippuric acid, and struvites. And just note that there are two different types of calcium oxalate. We have the calcium oxalate monohydrate and the calcium oxalate dihydrate. Okay, so let's just take a look at this. Which crystals form in which pH? So actually calcium oxalates can form in either or, just so you know, but calcium carbonate and calcium phosphates form in alkaline urine. Triple phosphates, which are also struvites, it's the same, different name for the same thing, also form in alkaline urine. And we know that bacteria can make urine more alkaline. And then we have the formation of these types of crystals. And these are often called infection crystals or stones, because once the urine is more alkaline from a bacterial infection, we're more likely to see triple phosphates or struvites. And also, since we talked about uric acid already, uric acid crystals are more likely to form in acidic urine. And then also ammonium biurate can form in either type. The first crystal we're going to discuss are the struvites. Struvites can also be known as triple phosphate, ammonium magnesium phosphate, and also infection stones because they are related to UTIs. And if you can see on the right here, they are usually rectangle. They are usually 6 to 8 sided prisms. Some people say they look like coffin lids. I think they look like little envelopes. And you can see in this sample, we also have some red blood cells as well, these little donut shaped things. And we most likely have some bacteria. These are called infection stones because they're usually associated with UTIs. They can be seen in normal urine in small numbers, but usually when we see a lot of them, it is due to either stone formation in the bladder or UTIs. They can be associated with diet, again, because some of the elements of them are magnesium and phosphate that make up these crystals. When it is associated with diet, we can use urine acidifiers to control the diet. If the urine is acidic, they won't form because they usually form in alkaline urine. Some of the diets that you may have heard of, like Hill CD or Royal Canin urinary SO, these diets have a reduction in magnesium and phosphorus and protein, and they also help to acidify and dilute the urine. because these crystals usually form in alkaline urine. Some bacteria, actually urease positive bacteria, can turn urine alkaline. The bacteria themselves make the urine more basic because they break down urea into ammonia. So once the urine becomes more basic from the bacteria, you'd see more of these stones forming. These are most common in dogs and cats, and a few of them can be normal. Calcium oxalate crystals are also very common. They're usually found in acidic and neutral urine, but they can form in both acidic and alkaline. They're usually associated with urinary acidifiers and genetics. They can also be seen with ethylene glycol toxicity or antifreeze ingestion. There are a few different shapes. The most common that you're going to see is the dihydrate, which is the one on the right here that looks like a square with a little X in it. And a few of these can be seen in normal urine in dogs and horses, but when there's a lot, it usually indicates disease. Calcium oxalate crystals or stones can form in a pet's urine when they're excreting too much calcium or too much oxalic acid. There are two types. We have the dihydrate and the monohydrate. The dihydrate are the ones that look like the little squares with the X's, and the monohydrate can have two different shapes. So they have either like a fence post shape, it looks like a little prism or sword, and then they also have this shape that looks kind of like a dumbbell, so it'll be round on both ends. The dihydrate crystals are colorless. They have the X in them, and they usually occur in urine of any pH. The crystals can vary in size, so they can be very small or very big, and that's true for the struvite as well. They can be seen in normal urine, and they can also be an artifact due to storage. And they may be seen with increased calcium excretion that is due to disorders affecting calcium metabolism. And also they can be seen in antifreeze toxicity. The monohydrate can also vary in size and have that spindle, oval, or dumbbell shape. And these can usually occur again in excess when there's an excess of calcium oxalate dihydrate crystals. So they may occur alongside the other form. Uric acid crystals may be seen in Dalmatians. They're not common in vet med in cats or dogs because in humans they're usually associated with things like gout and chemotherapy treatment. However, in Dalmatians specifically, they have a genetic mutation in protein metabolism and cannot dissolve urates in the body. These crystals are usually diamond shaped, yellow to brown. They kind of look like irregular rectangles. They may also be oval with points. Again, they're rarely seen, but for whatever reason, they are seen in Dalmatians, and they are most common breed of dog, although there are some other breeds of dogs that may develop them and are at risk. But the genetic mutation that Dalmatians have prevents their liver cells from converting uric acid into allantoin. Allantoin is a chemical substance that's easily excreted in urine normally, but since Dalmatians can't produce it, the uric acid builds up in their bodies and crystallizes. These crystals can form stones in the kidneys and bladder, and they can block urine flow, causing severe pain, kidney failure, and even death. Many Dalmatians have a hereditary abnormality, and Dalmatians have nearly 100% chance of inheriting this, but not all of them will develop the stones. To prevent urate stones in a Dalmatian, for example, you can try feeding them a low purine, low sodium diet, and also encourage them to urinate as frequently as possible to flush out the urinary tract. Calcium carbonate crystals, you see on the right here, they are, to me, they look like furry little balls or pom-poms or something. Some people say koosh balls, but they can also look like these round circles here that have, they're almost like the pupil of an eye or something. So they have a couple different looks. They're commonly seen in horses and rabbits, and they're not usually clinically significant. They form in alkaline urine, and they do look like spheres or dumbbells. They are yellow to brown in color. You could see one dividing here. These crystals are common in normal urine of horses, rabbits, guinea pigs, and goats. They've not been observed in canine or feline urine. The urinary stones that form in horses are due to a combination of factors related to urinary tract function and mineral balance. So, for example, the minerals in the urine, horses normally excrete large amounts of minerals such as calcium carbonate in their urine. We may also see amorphous crystals, which really don't have too much of a shape. They don't look like any specific type of crystals, and these are not usually significant either. They can be due to artifact like temperature. So if you see something like this, you'd probably want to repeat the sample and get another sample and run it and see if you see them again. Amorphous crystals can occur due to certain types of drugs. They usually form when there are phosphates or urates in the urine. They can be confused with bacteria. And like I said, certain drugs and also radiographic dyes can cause these amorphous type crystals as well. Two more crystals we're going to talk about are the ammonium biurate and the bilirubin crystals, which kind of look a little similar. So the ammonium biurate are usually described as thorny apples. They're yellow to brown and they have these irregular spicules on them. And some people say it looks like a thorny apple. The formation of these ammonium urate crystals can be caused by a combination of factors, including decreased urine volume or oliguria, or any condition that alkalizes or makes the urine more alkaline, the pH of the urine, such as a vegetarian diet or UTI. And these crystals can cause blockages because they can form stones or calculi. Calculi is another word for stones or uroliths. It's all the same thing. Certain medications can cause these crystals. Again, they're yellow to brown, spiny. They can be generally of little significance because they're related to the pH of the urine. The formation of these crystals can be caused by other significant diseases like liver disease, for example, some medications. In people, they're seen with gout and with chemotherapy treatment. So they are urate crystals, remember? So, and we know that Dalmatians can't break down urates. So these are also common in Dalmatians. They're frequently seen with amorphous crystals. They can be associated with portovascular anomalies. So again, they're common in Dalmatians because they can't break down those urates, and also in English bulldogs. They can be seen in other dogs or cats. Ammonium crystals suggest liver dysfunction or portosystemic shunting. So if it's not related to the pH, for example, it's probably something more severe like liver disease. The other crystals I want to discuss are the bilirubin crystals, which are similar looking, but these are also yellow to brown, but they look more like bundles of little needles with spikes on them. And these also can be related to liver disease, right? Because of bilirubin. Whenever there's excess bilirubin in the blood, you may see bilirubin crystals in the urine, and also the urine would be positive for bilirubin. All right, so let's talk about some of the microorganisms that you may find in urine. The most common is obviously bacteria with urinary tract infections. It's also going to depend on your urine collection method. We talked about this earlier, but if you're using a cystocentesis method or a catheterization, you shouldn't see any bacteria in that urine sample. It's normal to have a few in a free catch urine because remember, the urine is passing through the skin and there's bacteria on the skin. As far as looking for urine, it is easier to look for bacteria with unstained urine than it is for SETI stain. A few bacteria are normal in a free catch sample, but if this urine is left out, for example, they may multiply. So remember, if you have a sample and you leave it out for a while and there's excess of bacteria, it is possible, especially if it was a free catch, that the bacteria have multiplied while sitting out. So here's a example of bacteria. We can see bacteria is really small. They're going to be either rods or cocci or chains of rods, or cocci are the little sphere ones. So chains of spheres or rods, depending on the species. We report bacteria out, again, how many we see per high power field. If there's so many, it's kind of like red blood cells. We say too numerous to count. right? And at that point, we would have to run a urine culture, gram stain the slide, and find out what kind of bacteria we're dealing with that caused the UTI. So the culture would be run so that we could get that MIC that we talked about in pharmacology to prescribe the right antibiotic. Another organism that you may see in urine is fungi or yeast species. The yeast are going to look bigger than the bacteria. Like you can see here, we have a white blood cell, we have some red blood cells, and the yeast are considerably sized compared to those, whereas the bacteria are very small. And I just want to take a moment here to show you the different types of bacteria and the different shapes they can take on. So you have the cocci, which are the round, you have the bacilli, which are the rods, and they can be in chains or clusters. And then you have budding and appendaged bacteria. And then you also have spirochetes, like leptospirosis is a spirochete. So although rare, there are some actual parasites that we can see in urine, and we would see their cysts. The Piercinoma capillaria pica is one of them. That is a bladder worm. That's this guy up here. And then we have Diatoctophyma renale. So renal, we know is kidney. Giant canine kidney worm, and this is its cyst as well. And this is the largest nematode to affect domestic animals. And then also Diaphilera mitis, which is canine heartworm. This is the heartworm right here. So because it's in blood, and if there's hemorrhaging in the urinary tract, it can wind up in the urine as well. There are some things that when we see them in urine, they're artifact or not clinically significant. One of these things is mucus. Mucus strands, which you're looking at right down here, they kind of look like ribbons. They're twisted, and in my opinion, they do look kind of mucusy when you see them. So it does look like a twisted ribbon. This is common in horses. In excess, they can indicate urethral irritation or UTIs possibly, but a few, again, are normal. Another thing we may see are fat droplets. That's what you're looking at up here. They're light green to yellow, and they're very refractile, meaning they refract the light. They can be seen in cats, obese animals, diabetic animals, and hypothyroid animals, but again, a few are normal. These are going to vary in size greatly. So if you can't tell the difference between these and the red blood cells, try and look at the size and try and zoom in and out and see if you can get that refractile shine from them that you're not going to get from red blood cells. Air bubbles are another thing that you may see, and they're going to look kind of like this, like big black circles. And that's just air trapped between the cover slip and the slide. And these also are an artifact. And then the fat droplets, in comparison to them, will not have that ring, but they will look refractile like these here. Another thing we may see is sperm. Now, sperm is common in an unneutered dog or in a female that was recently bred. And there are a few other things you may see in urine besides the ones we discussed, the sperm, the air bubbles, fat droplets. You may see starch granules from gloves coming off the gloves as you're making the slide, hair from like a voided sample. It may even be your own hair, you don't know. Feces is very common to see in urine sample, right? More common in females. Plant spores, all kinds of plant material you can see in urine. Urine is actually very interesting. There's, whatever the animal's ingesting and not digesting comes out in urine. And we have, and stool. Pollen, if you look right here, we have some sperm. We have some fibers, possibly fabric. We have some plant material here. This right here is pollen. This little Mickey Mouse looking thing we call them is a species of pollen that's very common in urine. And if you look at this urine, it's filled with red blood cells as well. Now, if you see something that you can't identify, and there's a lot of them, you probably want to do some research and see what it is, because there's all kinds of stuff, as I mentioned, that can be found in urine. Pollen, glass chips from the slide, the cover slip when you're making it. And if there's only one, of some random thing that we don't know what it is, it's probably not significant. But if we have a lot of something, then we need to find out what it is we're looking at. Trichomes are another thing that you can see on a slide of unstained urine. All of these, this is unstained, this is stained. And I'll talk about trichomes on the next couple slides. In this slide, I just wanted to show you guys what unstained sperm looks like. So you can see a few of them traveling around on this slide, and usually they will be moving. We have one here, we have one here, we have one here. And lastly, I just wanted to show you just how many different forms plant material can take on. If you look up here, we have an example of some algae in urine. And then here we have a long strand of blade of something, and you can actually see the plant cells in it. And then here we have what's called the trichome. The trichomes are basically appendages or outgrowths on plants, algae, lichens, and some protists. They have a variety of structure and function depending on the species, and they can include hairs or scales. And this one usually looks like a star. It's kind of folded up in here. So you can see that urine is a highly diagnostic and useful tool. And if you have any questions about it, please let me know.